Okay, normally around 50% of our cases are done because we have a male factor. 50% of the cases there is a problem with the sperm production. So in that case, normally for all our patients, we ask for a sample, for a sperm sample to be delivered at the clinic, and then we analyze under the microscope. And in the microscope, we analyze a lot of parameters of the sperm. We analyze sperm concentration, motility, morphology, etc. But from all these parameters that we can collect from the sperm, the most important one is the total amount of motile sperm that is available in the sample, because those motile sperm will be responsible for the fertilization of the egg. So this is the most important part of the analysis. Definitely it's a very important matter in our society. Most of our patients, most of the males are really aware about the problems of infertility when they have to try to have a baby for more than 6 months. So most of them maybe were already infertile and they never know until the time that they try to have a baby. So it's definitely a taboo, and most of the patients, most of the males are not interested or even are scared about the possibility of being infertile because of the problems of society, problems that will be related with that problem. Well, this is a problem. The possibility of the patient or the male of thinking and have an appointment with a doctor, and even in that appointment to have to deliver a sample in a small room is not an easy task for them. So in many cases, the wife or the partner is very important, trying to make sure that the patient will be able to deliver the sample. So in any cases, in most of the cases, it's a problem for our patients to deliver the sample, or some of them, because it's sometimes even traumatic for them. We get an approach from SwimCount founders that we know already from previous studies, and they were in IVI. We are very interested always in new technology, new tests, new things to be applied to our patients. So we were very interested with the idea. What we proposed to us was to apply this new diagnostic test, which basically will be able to count or to measure the amount of motile sperm in the sample, and then have an idea of the proportion of the amount of sperm is high or is low, etc. So we were very interested in that study because potentially for us will be a way to introduce a new diagnostic tool in our clinic. Well, there are two main reasons for us to think that this is a good test. First of all, the possibility to do a home test. The possibility to have an approach of an idea of the sperm quality, not going only to the sperm concentration, but also going to the sperm motility, have an idea of the sperm quality, doing a home test, avoiding all the problems that are behind the possibility of delivering a sample at the clinic or even at home with some pressure of doing it in front of the doctor. That's one of the reasons. The second one is the possibility to do a diagnosis of the infertility problem in advance, to know previously where is the problem, and also to have the possibility to do the treatment before what we believe that will be the normal time of the treatment, because the patients already will know the problem and probably they will come to the clinic to do the treatment in the right timing. So right timing for the treatment will mean also more chances to become pregnant for the patient. So I think it's a good situation for the patients and also a good opportunity for the clinics in order to have the patients in the right timing to receive the treatment. How the test works is very simple, because it is based in 4 steps. The first step is just to collect the sample at home, and then you have to wait 30 minutes. From that sample you have to pick up around 0.5 ml and put in a special surface and special deposit in which is the system placed, and then we move the position of the system and we wait 30 minutes more. In that time, what we are doing is like a swim up procedure. The sperm samples are moving, the motile sperm are moving to another place, and then it's going to produce a staining, and that staining can be analyzed by the human eye, and depending on the color, we can know if the sperm sample has a poor quality, medium quality, or high quality, depending on the total motile sperm which is in the sample. The clinical test has been done in 250 samples, so the quite large number of samples analyzed between 3 different clinics. In that test, what was done was applying the SwimCount and at the same time take a look at the samples in the standard microscope. and then they analyzed the correlation between both systems. The correlation or the exactitude of the measurement was around 95%, which is quite high. So the conclusions of the study was that there was a very good correlation between the standard way of the counting of the total motile sperm in the sample and the analysis done by the SwimCount. SwimCount for me is a very simple technology that has put in the market a different thing that was previously done. Is not only concentration, we can also know the proportion of sperm that are motile, so this is completely new. So we are providing a home test that is not only providing concentration, it's also providing motility. That's the first thing. And the second one, from our point of view, like clinicians or IVF units, that probably will be able to manage or to have a previous diagnosis of the infertility problem in the male partner. So it's a good way to receive the patients or to have the patients in our clinics before the right timing, because the patients already will know the problem. So I think in general will be good for patients, but also will be good for the treatment, because probably we will have patients sooner at the clinic with a better diagnosis in the case of male.